Come in.
Hi, I'm Dr. Pierce. It's good to meet you both.
Hi, Dr. Pierce.
Wow, you have an awful lot of certificates on your wall.
Oh, thank you. I earned my bachelor's degree at UT Austin, and I went to Johns Hopkins for med school. And then I completed my fellowship for endocrinology at Johns Hopkins Children's Center.
That's very impressive.
Thank you. So what brings you to my office today?
I passed out today at the gym while doing cardio.
Okay, well tell me how you've been feeling the last few weeks.
Well, I've noticed that I can't run as long as I used to be able to. I used to run 20 minutes straight, but now I can only run 10 minutes and I'm still tired after that. Even on a normal day at school, I feel extremely tired and I get dizzy really easily. I'm also thirsty all the time.
Tell me about it. You went through a whole pack of water bottles in a week.
Well, do you feel any better when you take a sip of Gatorade or eat something?
Yeah, kind of, but only for a little while.
She's actually lost a lot of weight too. I'm worried. She eats well, but she sheds weight every day.
Anything else that you've noticed that's different about yourself?
Well, I'm really hungry all the time, actually. I used to be satisfied with one meal at Chick-fil-A, but now I have to eat at least 2 sandwiches. It doesn't make sense because I'm losing so much weight. I also feel like my vision has weakened a lot. When I'm in class, the board looks blurry, even when I wear contacts.
What's wrong with her?
Well, okay. I have good news and bad news for you. Which would you like to know first?
Bad news.
Okay, well, I'll start with the bad news. Your symptoms conclude that you have type 1 diabetes, along with the blood test that you took earlier.
You're kidding.
Don't be rude, Kimberly.
I bet I got it from you, Mom.
No, that's not possible. It can't be.
Actually, your daughter is right. Type 1 diabetes is a genetic type of diabetes which is passed on through genes in the family.
Oh my heavens.
Okay, so what now? Do I die soon? Should I do that Make-A-Wish Foundation or something?
That's for kids with cancer, sweetheart.
You're not going to die, Kim. That's where the good news comes in. Type 1 diabetes can be controlled and treated.
What even is type 1 diabetes? What's going on inside my body?
Good question. In your case, your immune system is designed to fight harmful bacteria. There are T cells in your body that normally kill off bad cells. With type 1 diabetes, your T cells start fighting your good body cells by matching to antigens on your body cells rather than antigens on your harmful cells. T cells that match to good cells are normally destroyed, but with type 1 diabetes, these T cells thrive in your body by killing off helpful cells, especially beta cells, which secrete insulin from your pancreas.
What's insulin?
Well, insulin is a hormone synthesized in your pancreas. It signals your cells to absorb sugar from the bloodstream so that can be turned into energy that your body can use.
So you're saying that my body is destroying my ability to make insulin?
Exactly. When your body kills insulin-secreting beta cells, insulin isn't present to help glucose enter your cells, which causes glucose to build up in your bloodstream. And your body lacks the necessary energy to carry you through the day, which is why you say you've been feeling so fatigued and weak.
How exactly does insulin help with regulation of blood sugar levels?
Well, if you have too much sugar in your body, then it actually needs insulin helps store sugar in your liver and release it whenever your body is low of sugar, such as when you're not eating or when you're working out. In this way, insulin balances the blood sugar levels.
How does this have to do anything with my blurry vision?
The lack of insulin in your body causes your blood sugar levels to rise. When your blood sugar levels rise, glucose accumulates in the lens of the eye. And then to dilute the high levels of glucose, the lens also absorbs more fluid. The extra fluid changes the shape of the lenses, which can affect the ability to see, because swelling in the lens changes its shape, and this causes blurry vision.
And why is she so hungry and thirsty all the time?
That's because glucose from the blood can't enter the cells due to the lack of insulin, so the body doesn't have glucose to convert the food that you eat into energy, and this lack of energy is what causes an increase in hunger. As for thirst, without insulin, glucose builds up in your blood, and if your kidneys can't keep up, the excess sugar is extruded into your urine, dragging along fluid from your tissues, and that's what makes you more thirsty.
So how do I fix this? You said there was a treatment, right?
Yes, treatment but no cure. I can start by giving you some insulin shots called Humulin to take daily in order to keep your insulin levels up.
She has to take it every day?
Yes, every day. And along with that, you're going to need to keep careful watch over your diet. Avoid sugary foods and gear towards anything packed with nutrition. You also need to exercise daily. The goal here is to keep your blood sugar levels as close to normal as possible.
Okay, I guess that's not too bad.
How can we make sure her diabetes doesn't get out of hand?
You're going to need to test your blood sugar every day. with blood glucose test strips. It's just a small prick to the finger for some blood, something you'll get used to over time.
Oh my god, my grandma does that. That sounds like fun.
Trust me, you will get through it.
And when will we see you again?
You're going to have to schedule a doctor visit every 3 to 6 months so we can check up on you. The nurse out front will help you with that.
Alright. Well, thank you for seeing us today.
Of course. Give me a few minutes and I'll meet you up front to write you a good prescription. It was nice to meet both of you.
Nice to meet you.
No, thank you.
Okay.